Hi, it's Mel here. This episode is brought to you by my online course, the PCOS Fertility Plan. If you are wanting to get pregnant naturally with PCOS, you're wanting to regulate your cycle, supercharge your fertility, and you are getting overwhelmed by how to do that, and you want to learn about how you can do that from somebody who's been doing it for years at this point and has helped so many people get pregnant, I think you're really going to enjoy my course. In it, I'm going to help you get to the bottom of why you are struggling to get pregnant, and I'm going to teach you all the things that you can do to overcome that in the simplest, easiest way possible. We're going to come up with a plan that you actually understand and that you can follow, and you have full access to me once you sign up to the course. You can email me anytime. I've put the link in the show notes, and don't forget to use the discount code PCOSGirls30 to get 30% off. Let's get into it. Hello and welcome back to the PCOS Girls podcast. I'm Melissa Christie. I'm here with Bridget Warren. Hi.
Hello.
Today we are talking all about the things that no one tells you about perimenopause and PCOS. And this has been quite a requested one, which you know what I'm quite comforted by, because I'm about to turn 40 and I'm glad I'm not aging out of our audience. I'm glad I got some people there with me.
I think it's great because this is what I was saying to you as well. Like, even if you're not, there yet, which, like I'm not there yet, but, I could be on, who knows? Like, I don't know. I've got friends who went into perimenopause in their late 20s.
Whoa.
So, yes. And that was horrific. And for years, I didn't know that was what was going on. But yeah, that's what it was ended up being. So it does, not that that's the norm, of course, but it does happen. 35 upwards is usually when you may or may not start to see symptoms. So
that's
hey.
It's the may or may not. It's the wondering. And I think that's part of what we're going to talk about today, is just like, I don't really know.
Who knows?
Because PCOS and perimenopause, they're kind of pretty similar.
I know. And I think that's what we sort of kind of discovered in our like research that we were doing for this app. It's just like, oh, wow, okay, there's quite a lot of similarities or things that you might not even have assumed were peri, that maybe peri, there may be PCOS. It's so confusing. But yeah, I think that was like a big takeaway from me, was like, how would you even know?
I know. But there's a positive to it, and we will get into that. But how have you been?
I've been good. I've been really good. I actually did have a big fall at tennis last week, and I smashed my knee, and I looked like a 4-year-old with like razors all over my leg, but then it got infected.
Oh, no.
Yeah. So I have just, unfortunately, I usually have tennis in the mornings, and I didn't go today because
I noticed that.
Kind of rest. But anyway, good. The other thing that's been happening to me, it's a big deal in my household at the moment. I am merging my chickens together.
Oh, so I saw you got 2 new ones. And so what? They're meeting the originals.
So I have 2 new ones. Yeah. Actually, so I've got 2 new silkies. If you know your silk chickens, they're those they're like bunny rabbits. Like, I don't know what is going on there. And they just sit on your lap and they just want to like be patted. It's weird. And then I have my 2 OGs. Had them for like 4 years now.
Yeah.
And then I recently got, last week, I picked up some rescue chickens from, so picked them up, and they are not looking great, but we're going to get them there. Don't worry, they're going to look amazing. But they are so terrified and scared of life that they keep trying to attack anyone and anything that goes near them. So it's been a real process trying to integrate all the people together.
People.
The chickens, babies, whatever you want to call them.
The babies.
All the little angels. Anyway, so that's been my life this week. I've been hobbling around on one.
Nice life. Well,
yeah, look, I know, but it's been adorable, and I'm here. I'm enjoying the slow week that I've had.
I feel like getting infections from grazers, like, does it make you feel like you're getting on a little?
You want to know what was so embarrassing about it? Like, fucking hell. So basically, I had this graze on my knee, and it was just sort of felt like it was getting sore and sore. And I was like, this is so weird. I had one of those like waterproof gauzes on it. But you know, grazers, they weep so much. Like they're just moist and just moist. They're just disgusting all the time. Anyway.
Welcome to the PCOS Girls podcast.
Hi, guys. Moist. I went to get my skin check done. So this is another really good thing. I went and had my mole check done, and first time in 2 years, I haven't had to get a biopsy on any of my, like for a year, because normally I'm on like every 3 to 6 months, depending on where I'm at with my mole check. So I'm clear for a year.
Yay. Oh, congratulations.
Thank you. But in that process of getting the mole check, the doctor said to me, oh, can you just take off all the bandages around your knee so I can check around your knee for any moles? And I pulled it off, and she was like, girlfriend, that needs to be seen by a doctor, like a GP, like that's an infection. And I was like, you're joking. So anyway, had this kind lady not looked at my monkey knee, I would have had a probably far worse infection than what it has been.
I had a spider bite a couple of years ago, and it got infected. And I was like, what? Like, it made me feel old. Like, it made me feel like, where's my fighting body? And it was so full on. Like, I had to go to hospital several times.
I actually remember this.
Yeah, maybe I was probably podcasting at the time. It was horrendous. I was on antibiotics for weeks. I was just like, oh,
you poor thing.
Yeah.
Thankfully, I just needed to clean it up. It wasn't like I take antibiotics or anything, but just needed a little it needed also not the waterproof bandages. It needed the breathing ones so it could crust up a little bit. Sorry. Anyway, back to you, Mel. How are you doing? How's your
Well, I'm good. I'm on day 1 of my period, so it's just to keep it going with the
How are you feeling? Energy high, energy low?
I mean, I feel mostly I feel good because I've realized. And I mean, this is kind of embarrassing. I didn't realize this sooner, especially given my job. And this is a bit of a not practicing what I preach thing. Like, I'm very good at tracking my cycle, and I tell people to track their cycle. And part of that is track your moods. But I have just missed this my whole life. And I can see why. But in the week leading up to my period, I don't know how to express this. Okay. I have never known whether I am somebody who is an introvert or an extrovert. I've never been able to figure it out because because I think one of the big things I remember learning about how to tell is, how do you feel in social situations? Do they energize you or drain you of energy? And most of the time, actually, I'm really energized by it. In the moment, I'm very I'm flitting around the room. I'm doing my thing.
She's a social girl.
I am. And I leave feeling myself and feeling great and cup full.
Yeah, okay.
And then sometimes it is so hard to be that, to be me. And it's confused me so much. And to the point where I've been because I think I might be autistic. I think I might have ADHD. And I have been is the whole thing a mask or something? And then I can't always mask. And I haven't been able to figure it out. And I've just, honestly, for decades, I've been I can't figure this out. And I have now figured out only in the last few months. And I think part of it is because of this curiosity around whether I'm in perimenopause. I've been sort of just really observing. And I've realized, it's just in the week leading up to getting my period that I go into I'm introverted. The rest of the time I'm feel me. And then I just go really introverted. And it has been the best thing to uncover, because in the past when I've been in these situations where I feel awkward socially, I don't know, I find it hard to listen, and I'm not me. And I've always just it's kind of gotten me down. And now that I get it, and I'm just and it's actually very typical too in that week leading up to your period that people get more. I've known this stuff. I've taught
I'm
this
I feel like that's most women. We know this.
I know, but I've never realized it for me. And so now I feel really that's all it is. It doesn't freak me out anymore. And now I just accept it. And it's
so are you still landing in that you're an introvert or an extrovert?
No, I don't know. Maybe no one is one or the other. Maybe everyone's a bit of both. But I think if I had to pick, I think it'd have to be extrovert, because I think that's who I am most of the time.
Wow. I love that. That's so crazy.
Anyway, so I'm on day 1 and I do feel more, here I am.
Here you are. Yeah. I love that. Well, I feel like that's a very common experience. Welcome to the club.
Hi. Didn't know. I'm probably not autistic. It's just been this one
Just
week.
in this 1 week that you're like,
Oh,
like,
God.
I don't know what's going on. Oh, that's
Yeah,
amazing. Well,
I
like,
know.
yay. Well, I'm ovulating, so woo.
Okay, so we're both feeling good then.
We're both feeling good.
Let's get into this.
All right, let's do it.
All right. I feel like you had something really good to say about this when you were talking about the whole like PCOS and perimenopause having really some similarities.
Yeah, well, I think because this topic, we were both sort of like, oh gosh, how do we approach this? Because I don't know much about this. I'm not in that stage of life yet. Like it felt a bit far off. But then really when I started to deep dive on it, I realized pretty quickly that there are a lot of people probably would even if you've dealt with PCOS your whole life or for as long as you've known, let's say if you've got to your 30s and you've known for 10 years that you've had PCOS, you've been dealing with it for a while, you've been managing it, you probably just got on top of it, you're probably feeling like you've finally worked out how to balance everything out. And then I think what happens with a lot of women who hit peri is these symptoms start to come back. And a lot of the symptoms are really similar to the symptoms that we would have been experiencing with PCOS. So weight gain, exhaustion, brain fog, not sleeping well, hair changes, like there's so many similarities, irregular cycles, like the list kind of went on and on. I think that for me, I think that it would be so easy for me. Let's say I was in perimenopause and I wouldn't even think it. Like I would just sort of go, oh, this is my PCOS flaring up, or I've got to get on top of my PCOS. So for me, that was a really big eye-opening thing. And I would imagine that a lot of women would experience that same thing and probably not know for quite a while that perhaps it is peri, perhaps it is PCOS, perhaps it's a little combination of both.
Yeah, but it kind of means we're prepared for it.
It does. And I loved this take on it because it was kind of like, if we can handle PCOS, we can handle peri.
Yeah, we're probably more prepared than other people because they've not had to deal with the irregular cycles and all these changes that we've kind of been battling for however long.
Yes.
But this is kind of why I questioned if I've been experiencing it, is because last year I started to have some weird cycle things happen. And I've always aired on the side of having symptoms of low estrogen, and then I started to get some symptoms of high estrogen, which has never been me. And I was like, oh, this feels perimenopause-y, because perimenopause is this to and fro
fluctuation. Yeah,
that's right, fluctuation of hormones. And so I started to think maybe that's what's going on. And honestly, I don't know, but I have the overwhelming feeling I have is just this acceptance of like, okay, well, I've been riding this wave. I think it's also easier for me to say that because I'm not trying to have babies. So if I have some off cycles, there's no big thing riding on it. The only thing riding on it is my health and happiness, and I'm pretty healthy and happy. So it's easy for me to be able to be accepting of it because I'm not trying to get pregnant. And I think if you're trying to get pregnant, then it's going to be more like, okay, I really want to face this and tackle it.
Definitely.
And we'll get into, I guess, it kind of leads into the thing that I found most interesting about this and about this sort of the difference or the link between PCOS and perimenopause is that when we enter into perimenopause, it's kind of just coincides with as we're aging sort of into our 40s, our testosterone levels naturally start to decline, which is, would seem very wonderful for PCOS because lots of us are dealing with that. So the testosterone levels naturally decline. Great. However, our estrogen and progesterone levels naturally decline as well. So it can leave our testosterone levels unchecked. So on paper, the testosterone might start to look way better than it used to. However, because it's not as like testosterone and estrogen and progesterone are in a balance, they check each other. And so because those are decreasing as well, even though the testosterone levels might be lower than they used to be, the symptoms might still be there.
Yes.
Because of that lack of balance. So it just means it can be a bit of a shift in how we approach our PCOS. So you might be really used to approaching PCOS by targeting the testosterone and trying to bring that down. But now maybe there needs to be a bit of a shift in actually focusing on supporting the estrogen and progesterone levels instead.
Okay, quick little pause because I want to shout out today's episode sponsor, which also happens to just be me talking about my own brand. So bear with me because I genuinely do love talking about this. PCOS to wellness is something that I built because I was done being dismissed about my own PCOS journey. I went deep on all things hormones, herbal medicine, and fertility. And by deep, I mean I went and created what I wish I'd had all along. 100% organic herbal tea blends, professionally formulated and made specifically for us. Our best-selling Sisterhood tea for hormone balance and fertility, Chaihood for blood sugar and reducing inflammation, Zenhood for stress relief and sleep, and of course our beautiful motherhood range for those of you on your conception or pregnancy and postpartum journeys. Because from the very beginning, I have just wanted this to be something that actually genuinely works, but is also something that can be affordable and accessible and just added into your everyday routine. And our reviews are incredible. We have reviews from thousands of women all around the world, and they still make me emotional to this day. Women talking about their cycles regulating, their skin finally clearing, their energy coming back, and of course, the little Sisterhood tea babies. Women who've been struggling with their fertility and have finally got a positive test. That is why I do this. That is what I love about it and why I have continued to do this now for 7 years. If any of this is resonating with you, there is a link in our show notes and you can use the code PCOSGirls20 for 20% off. All right, let's get back into the episode.
So I thought that was really interesting. And one good thing, if you're somebody who experiences acne from the elevated testosterone, that women report that improving decreasing because that really is driven by the testosterone levels. And as they're declining, that can get better. Unfortunately, it doesn't merely mean less hair fall necessarily because perimenopause has its own hair fall issues.
Stuff going on.
Well, estrogen is really like hair
necessary.
It's really good for growth of hair. So as that decreases, you can have some hair fall. Yeah. So, but I mean, that's nice about the acne. And I just thought that was really interesting that there might just be a shift in focus in how you manage it. So I'm really keeping that in mind. Yeah. That it's really, and there's so much that you can do for estrogen and progesterone. There is hormone replacement therapy, which is very commonly used in perimenopause and menopause by the Western medical system. And there are so many people who love it and really, really benefit from it. And part of that is that natural micronized progesterone that we talk about often in these episodes, micronized progesterone being very natural, however, a prescription medication from your doctor. That's part of hormone replacement therapy. So it's something that as people with PCOS and who've been on fertility journeys, that's a medicine we've been dealing with and talking about for a long, long time. Yeah. And so that continues to be an option. And then there's lots of natural medicines that can help us with estrogen and progesterone as well. Spearmint tea can help. Grapefruit juice can help with estrogen. Dongui is an estrogen balancer. So whether it's high or low, it can help to just keep it balanced. Red clover is another one. And then on the progesterone front, we've got peony and licorice root, vitamin B6 and vitamin C. Lots of options that we can have for helping to support those levels and help keep that testosterone in balance.
Yeah, I love that. And it's funny because I kind of stumbled across the same thing about a lot of people get, there is this drop in androgens and you might see some improvements, but then realistically, like your androgens still might be higher than the other parts of your other hormones. So it's still going to, might outweigh. But I think, like we said before, the good thing is we already got the tools. We already know what we're doing. So one of the biggest things that I sort of came up when I was doing my research is this kind of link between blood sugar balance, insulin resistance, and obviously PCOS. We know that that's something that many of us are contending with, but also it becomes even more so when you're entering perimenopause, you can become much more sensitive. So we really want to make sure that we are monitoring our blood sugar. And so I think, things like if you're feeling those energy crashes in the afternoon, sugar cravings, brain fog's a big one. I think a lot of people don't associate with blood sugar, but that's a really big one when it comes to brain fog and just feeling like you're trying to do everything right, but nothing's kind of landing. A lot of that, again, comes back to blood sugar balance. So just making sure that, we're looking at things like the way we're exercising. So maybe rather than doing those really hardcore exercises, we might want to make sure we're having some protein and food before we go and exercise, just so that we can maintain that. Going out for a walk after we eat is a big one. We talk about that so much with PCOS, but like a simple 10-minute walk after we eat can be incredible for about helping blood sugar balance. So yeah, the protein, we know that's a big one. And even sunshine in the morning is another really great one to be trying to do as well. It can be great for helping to balance blood sugar levels. Herbs, sea lime cinnamon, it's huge. You've got to be the true cinnamon. Don't get the stuff from the shops. It doesn't work. You want to get that true sea lime cinnamon, ginger, turmeric, cloves, licorice root. Berberine's another really interesting one. It's one that I wouldn't recommend just going and buying without perhaps consulting with a health practitioner or a naturopath or someone prior, because I do think you can overuse it or take too much of it, or it can have quite extreme side effects. Impact, side effects. But yeah, it's another really interesting one to look at. And all the other herbs I've mentioned, other than berberine, we actually have in childhood tea, which is specifically done to help reduce inflammation and balance blood sugar levels. But you can get them individually, you can get them as teas, you can get them as just the herbs as well if you want to use them in cooking. Like there's so many ways we can introduce those herbs into our day-to-day. But yeah, berberine's a really interesting one, and I'm not sure the link with peri and berberine. Well,
actually, I was reading about it a little bit because it came up in what I was reading as well. So yeah, it can be helpful for lowering blood sugar levels. It can also help to decrease testosterone. But in terms of perimenopause, so in perimenopause, there's this visceral adipose tissue or fat can increase in perimenopause. Isn't that lovely? Which is that deep sort of fat, belly fat that is wrapping around organs.
Well, that's what they say as well. It's like a lot of people who enter perimenopause, they kind of feel like they've got that tire around their waist. And that's usually what they're referring to is.
Exactly.
Yeah, that fatty tissue.
Well, it's been found that berberine can directly decrease that particular type of fat. So it can be helpful in perimenopause for that. So I just thought the fact that it does that, plus it can bring down the testosterone if that's still needed and lower our blood sugar levels. I thought that is a pretty interesting
It's a really
one.
interesting
like,
one.
I'm keeping that in mind for myself because like you say, with insulin resistance being something that can increase in perimenopause, for me as someone who I just feel like for years now, I kind of got my PCOS under wraps. That's why last year when my cycle started getting funny again, it was like, I wonder if this is perimenopause because I'm not doing anything different. I feel like my PCOS should be pretty fine and stable. With insulin resistance, kind of the same thing. I feel like I've got my ways and I'm like, okay, I'm on top of that. But now that I know, okay, it can flare up in perimenopause, it's something I'm just going to keep an eye on, I think, from now on and just see if I start to see those symptoms, it's like, okay, that's probably perimenopause. And maybe I just need to do a little more than I've been maintaining for years. Maybe I need to bring in a more powerful supplement for a while to get on top of it if I start to see that. That's kind of my takeaway from all of that. And berberine kind of shot to the top of my list of possibilities. Yeah. But I agree with you. Always see a practitioner about berberine because it's really powerful.
I took berberine for a little while and I was very sick.
I took it for a little while and found I really had to take it with food.
Yes.
But I thought it was great. It massively decreased my carb cravings, hugely. Yeah, felt great on it.
That's so good.
Apart from initially when I felt so sick from it.
Yeah, that was me. And I was like, this is not for me.
But I think my practitioner had, now I can't remember because I've talked about it generally so much, but she either I think she had me going off it for a week and a month.
Mine had the same thing. It was 4 weeks on and then a week off and then 4 weeks
Maybe
on.
that's your story then, because I think we had different advice. But the other one in my mind is that taking it through the week and not on weekends. So maybe that's what
that was yours.
Me.
That wasn't me. That was you. Okay. Yeah. Love that.
I love that you remember my medical history.
Yeah. I got you, girl.
Cool. What else? Was there anything else you wanted to cover?
Well, I really want to talk about cortisol as well because I do feel like cortisol is a really, really big one. We know cortisol is huge when it comes to PCOS, but perimenopause is a time when we are really cortisol sensitive. So the good thing is, like you said before, Mel, we've already got the tools here. We already are doing this for our PCOS. So we want to kind of do the same thing with when we're entering perimenopause. But like you said, Mel, though, you might have been like smoothly sailing for a while, and you've been able to manage day to day without too much thinking about it. And then all of a sudden things start to affect us more again. And that could be just the perimenopause coming to play and simple things like the cortisol, you're becoming more sensitive to it. So you have to reassess what you're doing. Yeah. I just think it's, sleep is a huge one, a huge one, particularly with perimenopause. Everything I've researched in perimenopause or menopause is like sleep is crucial. Your body needs the sleep, right? Same with PCOS, same with any sort of healing journey, anything really, but sleep becomes really important with helping to manage your cortisol levels as well. I mentioned it briefly.
Insulin resistance too.
Well, it does. And this is where, as I was going to say, it all comes back into play, even your workouts again. Like I've mentioned that briefly before when we're talking about insulin resistance, but we really want to, again, maybe look at cortisol conscious workouts. Maybe we stop doing those really intense workouts that we were doing and we switch over to yoga, Pilates, walking, weight training, whatever it is, just something that's not as intense on our bodies. That just like, so many beautiful things we can do. I said before about trying to get that vitamin D in the morning, the sunshine, that's going to help as well. Like there's just so many great things we can do. Herbs, chamomile, lemon balm, tulsi's a great one. Adaptogens like ashwagandha are incredible. Like there's some really, really good ones out there that we can bring in our day-to-day life. We have all of those in Zenhood, which is, again, specifically created to help with reducing cortisol and supporting our adrenals. But you can get these anywhere really, so don't stress too much about it. But we really just want to be looking at things we can do on our day-to-day lifestyles that are going to help rebalance that cortisol, which I think from everything I've looked into is a really key factor with perimenopause and the symptoms that can flare up. So trying to just stay chill, calm, go for your walks, catch up with your girlfriends, drink your tea, whatever you got to do.
Yeah. And I think now that we've sort of learned about all this stuff, I feel like it is something I'm going to be more aware of. Like I've just been in this acceptance phase and I really hadn't done much research at all. But now that, honestly, the research, I thought researching for this episode was going to take me down this rabbit hole and it was going to be another thing like on top of the PCOS, on top of the Hashimoto's, and honestly, that is how I felt. I just felt a little bit.
Yeah, you were very reluctant to do this episode. I was. I'm being honest.
Yes.
If I'm putting it out there.
I really was. I just didn't want to feel, I don't want to tackle another thing. Like I feel like I've done my time.
And I think as well, you were really conscious of us feeling like we were just throwing another hurdle at people. Yes. Like, here's the next thing you got to contend with.
But it did the opposite.
Yeah,
it made me
so
feel
nice.
like I'm prepared for this. It's just PCOS in a different way.
And we're already in this phase where we know how to handle things and we know how to incorporate rituals into our lives. And I think we are going to be good.
Yeah, we've got this.
We got this. I know. And how nice is that for you though, Mel, to like walk out and realize that, well, not walk out, but after doing the research and go, actually, this is not a big stressful thing we have to worry about.
Yeah, it's really, really comforted me. And so, watch this space. I will keep you guys in the loop if I start to feel any more symptoms or anything like that. But if you're listening to this episode and you were, for example, one of the people requesting it, would love to know if you have any remaining questions. Because now that I feel comfy talking about it, we're bound to have a Q&A episode coming up. So definitely throw questions about it our way.
Or if anything you've done that's been helpful, because I think that's another thing is like, we haven't done this yet, guys. This is new for us. Yeah. So if you are in this phase of life and you have been doing something that's been really helpful or been helping you manage, we want to know about it too. So let us know.
Thank you so much for listening. If you're not already, jump into our podcast community on Facebook. It's free. It's called the PCOS Girls Podcast Community. And we're on Instagram at the PCOS Girls as well. Thanks for listening.
Thanks, guys. Bye.
Bye.